Chemotherapy is a branch of pharmacology that uses drugs to target microorganisms and parasites in the body. These drugs can be natural or synthetic and work by either killing the microorganisms or inhibiting their growth without harming the host. Pharmacotherapeutics involves the use of drugs to diagnose, prevent, and treat diseases. It focuses on altering normal functions for therapeutic purposes and is crucial for healthcare professionals. Pharmacology connects various disciplines such as psychology, veterinary medicine, and biotechnology, highlighting its interdisciplinary nature and broad applications. Pharmacology today links its subdivisions and interface disciplines to other mainstream fields, as shown by the brown and green boxes in the diagram. Antibiotics are compounds produced by microorganisms that can kill or inhibit the growth of other microorganisms. This definition distinguishes between natural and synthetic antimicrobials. The term antibiotic now includes natural, semi-synthetic, and synthetic compounds. These drugs can treat infections and exhibit selective toxicity, harming parasites without affecting the host. Antibacterials can be bacteriostatic, which inhibit growth temporarily, or bactericidal, which kill microorganisms. The effectiveness depends on the host's defense mechanisms. Bacteriostatic drugs, like tetracyclines, inhibit growth, while bactericidal drugs, like penicillins, kill microorganisms. Bactericidal drugs are essential for severe infections. The distinction between bactericidal and bacteriostatic is not absolute. High doses or prolonged use of bacteriostatic drugs can kill microbes, while bactericidal drugs may sometimes fail. Achieving the right concentration of antibiotics at the infection site is crucial for inhibiting bacterial growth. Susceptibility refers to the effectiveness of a drug at non-toxic concentrations. Resistance occurs when the required drug concentration to inhibit or kill microorganisms is higher than what can be safely achieved. In vitro tests help determine this but have limitations. Gram-negative bacilli like Pseudomonas aeruginosa are sensitive to certain drugs at specific concentrations. However, sustained high concentrations can cause toxicity. Standardized in vitro tests may not always reflect clinical effectiveness. Drug concentrations in different body fluids can vary, affecting treatment outcomes. In the disc diffusion method, paper discs with antimicrobials are placed on an agar plate with microorganisms. The clear zones around the discs indicate no microbial growth. The diameters of clear zones in disc diffusion tests indicate drug susceptibility. The well method is also used for screening antimicrobial activity. The broth dilution method determines the quantitative susceptibility of an organism to an antimicrobial agent by measuring bacterial growth in broth with varying drug concentrations. In the broth dilution method, bacteria are incubated with different drug concentrations. The lowest concentration that inhibits visible growth is the mite. The MBC is the lowest concentration of a drug that kills 99.9% of the original bacterial inoculum. Mite and MBC results should correlate with drug concentrations in body fluids and tissues. For drugs that are primarily bacteriostatic, the minimum inhibitory concentrations, MICs, are much lower than the minimum bactericidal concentrations, MBCs. In contrast, bactericidal drugs show little difference between MICs and MBCs. Bactericidal drugs can be divided into two groups: those that exhibit concentration-dependent killing, like aminoglycosides and quinolones, and those that exhibit time-dependent killing, such as beta-lactams and vancomycin. For concentration-dependent drugs, the rate and extent of killing increase with higher drug concentrations above the MIC. For time-dependent drugs, maintaining drug levels above the MIC for the entire dosage interval is crucial. Concentration-dependent killing relies on the drug concentration achieved, with higher doses or less frequent dosing being more effective. These drugs often have a post-antibiotic effect. Time-dependent killing depends on the duration the drug concentration remains above the MIC, requiring longer infusions or more frequent dosing, and typically lacks a post-antibiotic effect. This graph illustrates the differences between concentration-dependent and time-dependent killing. Concentration-dependent drugs aim for a high peak concentration, while time-dependent drugs focus on maintaining drug levels above the mic for a longer period. Concentration-dependent killing is a key pharmacodynamic factor for aminoglycosides, which also possess a significant post-antibiotic effect. Time-dependent bactericidal drugs do not show increased killing with higher concentrations above the MBC. Their efficacy relies on maintaining drug levels above the MBC. Bactericidal activity is linked to the time above the MBC and becomes independent of concentration once the MBC is exceeded. Time-dependent drugs without a post-antibiotic effect should maintain serum levels above the MBC throughout the dosage interval. The post-antibiotic effect, PA, refers to the persistent suppression of bacterial growth after drug levels fall below the MBC. Many antimicrobials have significant in vitro PICE against gram-positive cocci, while fewer have PICE against gram-negative bacilli. In vivo, PICE are usually longer than in vitro, influenced by factors like post-antibiotic leukocyte enhancement, PAL, and exposure to sub-inhibitory antibiotic concentrations. Sub-inhibitory drug concentrations change bacterial morphology and decrease growth rates. The post-antibiotic effect, PA, is calculated as the time required for a tenfold increase in bacterial count after drug removal, minus the time for a tenfold increase in an untreated culture. Antibiotics are used as either empirical therapy or definitive therapy. Empirical therapy is initiated before identifying the microorganism, especially in critically ill patients, to avoid fatal delays. In critical cases, empirical therapy is started before identifying the microorganism and its sensitivity. For example, meningitis requires immediate treatment to prevent death. Optimal empirical therapy relies on knowledge of likely infecting microorganisms and their susceptibilities. Gram staining helps narrow down potential pathogens for rational antibiotic therapy. However, identifying the infecting organism's morphology alone is often insufficient, especially in life-threatening cases, necessitating broad antimicrobial coverage. Before starting therapy, it's crucial to take cultures of blood and other tissues to identify the infecting microorganism. This step is vital for accurate diagnosis and effective treatment. Definitive therapy involves switching to a specific antimicrobial agent once the microorganism is identified. Pharmacokinetic factors, such as achieving the minimal drug concentration at the infection site without causing toxicity, are essential for successful therapy. Sub-inhibitory drug concentrations can enhance phagocytosis, explaining why some infections are cured even when drug levels are below the mic. The goal of antimicrobial therapy is to maintain effective drug concentrations at the site of infection during dosing intervals. Adequate drug levels must reach the infection site to eradicate microorganisms. Natural barriers can hinder drug penetration, making it crucial to understand the specific challenges of different infection sites. For central nervous system infections, drugs must cross the blood-brain barrier, BBB. Inflammation can increase BBB permeability, allowing better drug penetration. However, drug dosage should not be reduced until the infection is fully resolved. Drug penetration into infected areas depends on passive diffusion, influenced by the concentration of free drug in the plasma. Drugs bound to plasma proteins penetrate poorly compared to unbound drugs. Prostate infections are difficult to treat because many antibiotics cannot cross the prostatic epithelium. The acidic pH of prostatic fluid further complicates treatment, though some antimicrobials like trimethoprim are effective. Maintaining antibacterial activity at the infection site during dosing intervals is crucial. The effectiveness of constant antibacterial activity versus high peak concentrations followed by sub-inhibitory periods is debated and depends on the drug's properties. Beta-lactam antibiotics exhibit time-dependent activity, while aminoglycosides are concentration-dependent. Studies suggest that pulse dosing of beta-lactams is effective, and aminoglycosides are efficacious and less toxic when given in large daily doses compared to frequent smaller doses. Clinical studies have shown that continuous administration of aminoglycosides may cause unnecessary toxicity. Knowing the patient's status and drug elimination mechanism is crucial for drugs causing serious toxicity. Oral administration is preferred whenever possible, but in seriously ill patients, Parenteral administration becomes necessary to achieve therapeutic plasma levels without delay. To achieve maximal therapeutic effectiveness, all factors governing the choice of administration route for individual drugs must be strictly followed. Host factors, such as the patient's status, play a significant role in determining the type of antimicrobial, its dose regimen, toxicity, and expected effectiveness. Renal dysfunction can lead to the accumulation of antibiotics eliminated by the kidneys, resulting in serious side effects if dose adjustments are not made. Special care is needed for patients with renal impairment, especially the elderly, as they are particularly vulnerable. Hepatic dysfunction requires dose reduction for drugs metabolized or excreted by the liver. In liver cirrhosis, the half-lives of certain drugs are prolonged, and infections may reduce drug access to the infection site. Age affects hepatic metabolism and renal excretion. Newborns and elderly people are particularly susceptible to the toxic effects of drugs eliminated by these mechanisms. Developmental factors are primary determinants of antibiotic type used. Certain antibiotics can affect the growth of bones and teeth in children and fetuses. Pregnancy can alter the pharmacokinetics of various antibiotics, and drugs can easily cross the placental barrier, affecting the fetus. Visual representations of conditions like blue baby syndrome and phocomelia highlight the impact of drug administration during pregnancy and early development. Visual representations of conditions like blue baby syndrome and phocomelia highlight the impact of drug administration during pregnancy and early development. Drugs administered to lactating mothers can enter the nursing infant via breast milk, potentially causing serious problems. Even small concentrations of drugs in milk can be harmful to babies. Certain drugs secreted in breast milk can cause serious conditions like hemolysis in children with specific deficiencies. Drug allergies are also a concern, as patients with a history of allergies are more susceptible. Host defense mechanisms are critical in determining the effectiveness of antimicrobial therapy. Infections in immunocompromised patients, such as those with AIDS, often require bacteriostatic agents and may relapse even after prolonged treatment. Patients with nervous system disorders are more vulnerable to localized or major seizures when taking high doses of certain antibiotics. Neurotoxicity is a significant concern in these patients. Local factors at the infection site, such as pus and pH levels, can influence the effectiveness of antimicrobials. These factors can reduce the activity of certain antibiotics, making treatment more challenging. Local factors at the infection site, such as pus and pH levels, can influence the effectiveness of antimicrobials. These factors can reduce the activity of certain antibiotics, making treatment more challenging. Penetration of antibiotics into infected areas like abscess cavities is impaired due to reduced vascular supply. The presence of foreign bodies further decreases the probability of successful therapy, making infections involving foreign bodies particularly challenging. Infections involving foreign bodies are characterized by frequent relapses and failure even after long-term therapy with high doses. The success in such situations lies in the removal of the foreign body. The cost of therapy can vary greatly between drugs with similar efficacy. Socioeconomic status of the patient should be considered when making the final decision on treatment. Definitions of terms such as prosthesis, glycocalyx, and bacteremia provide clarity on their relevance to the discussion of antimicrobial therapy and infection management.